In the real world, we don't have someone poking the outside of our discs. Rather, it's internal disc pressures which are most important. Anything which increases internal disc pressures can lead to stress on the annulus fibrosus and has the theoretical capacity to cause pain. And this was demonstrated in this 1949 paper by Carl Hirsch. He reports on 16 subjects who all had severe recurrent low back pain. Using X-ray guidance, he inserted a small needle about half a centimetre into one or both of either the L4-5 or the L5-S1 discs and injected about 2 mL of saline. This increased the interdiscal pressure and in every subject led to reproduction of their low back pain, identical. He then injected local anesthetic, which eliminated the pain, proving the involvement of nerves in this process. Nerves we now know which are located in the outer part of the annulus. One thing which is common to all these experiments is that the pain experienced on stimulation of an annulus was always poorly localized and in many cases described as muscular. This is due to the afferent signals from the sinovertebral nerves being carried to the brain via the sympathetic trunk, which you can see here. This makes it a visceral pain, which is like the pain you get from angina or appendicitis, and while aching in quality and poorly localized, it can be severe. Here you can see the pathway carrying the afferent signals from various spinal structures, including discs, the vertebral bodies themselves, epidural vessels, the posterior longitudinal ligament, and the anterior dura mater. These signals are carried along the sinovertebral nerves to the sympathetic trunk, where they ascend before travelling through the L2-3 intervertebral foramen to be carried by the L2 nerve, eventually reaching the brain. Pain from most of the lumbar spine is carried along a single nerve, a sympathetic afferent running through the L2-3 foramen, and this information can be used clinically both for diagnosis and for treatment. You see, if we can block the afferent signals arising from the discs and vertebral bodies and other associated anatomical structures, then we can block the experience of pain. So for instance, if we were to perform a block of this ganglion here, then we may be able to stop the pain signals ascending and reaching the pain, therefore blocking the pain experience. In this study, 33 patients with low back pain had a unilateral L2 nerve block on the side of maximal pain. And during the injection, 29 of the 33 subjects felt reproduction of their pain. And afterwards, all patients reported improvements in their back, buttock, or groin pain. An almost complete disappearance in 26 of them. And the benefits of these injections were not just limited to diagnosis. The average reduction in pain lasted more than 20 days, despite only using a short-term local anesthetic.
Annotated and summarized, easy to share with loved ones. The description below the title for this video has these summary points.